I'm Dr. Jonathan Sarik of Bayhealth Plastic and Reconstructive Surgery. I went into medicine initially for a lot of different reasons. I had a good number of influences on my family side, both from my mom and my aunt who were both nurses, and they strongly showed me that there's a real need for helping people out there. And that was probably the first motivator. And then going into plastic surgery, I had always, once I got into medical school, knew that I wanted to do surgery of some kind. But once I started my rotations, I noticed that there are so many different ways, especially as a plastic surgeon, that I can offer my services to help people and change their lives, both in the reconstructive side as well as the cosmetic side. So maybe changing something about yourself that doesn't make you feel as confident or like the full version that you normally are, or restoring something that either a trauma or cancer has taken away. I think the most important thing in providing patient care is listening to the patient and understanding what their goals are, what they're hoping to get out of whatever operation it may be. For instance, a reconstruction following an event, or just changing something about them that they're not necessarily happy with or confident about, and learning exactly what their goal is, because oftentimes physicians come in thinking that we may have the answer. We may know what the problem is and what we think the right solution is, but finding out what the solution is best for that patient is most important in my mind. I think the number one thing I would like patients to know about me is that I'm open, I'm honest. I want to hear exactly what your thoughts are and work with you to get to your goal, because ultimately, as I said, physicians oftentimes have our own preconceived notions about what we think is best for somebody, but talk to me. You know, I'm here to listen as much as I am here to help change something. And maybe the answer is no surgery, and that's also just as important as offering what I think may be the best operation. Some of the most common surgery procedures that we offer here at Bayhealth Plastic and Reconstructive Surgery are treatment for skin cancers. This area of Delaware has a wonderful exposure to the sun, but unfortunately that exposure over time can lead us to develop skin cancers. And here we're able to provide both the treatment for the skin cancer as well as the reconstruction that might be necessary. We also offer breast reconstructive services. Again, breast cancer is so common, and one of the most common procedures that I perform is reconstruction following a breast cancer surgery that another surgeon may have done. We also offer the entire spectrum of cosmetic surgery. So from head to toe, essentially, we offer cosmetic surgery. The most common procedures are usually around the face or the eyelids, but also breast augmentation and an abdominoplasty, or a tummy tuck, as we commonly call it. I would tell anybody considering cosmetic surgery or reconstructive surgery to ultimately think about what your goal is. Think about what you want to have changed, and I can help you figure out the best way to get there. And that's the most important thing, because if patients don't come in with necessarily a clear idea of what they're hoping to get out of it, it's very hard to set the expectation and achieve that goal. But once we have a very clear plan of where we're going, that's the easy part, is getting there.